Happy Friday, everybody. Welcome to the shit nobody tells you about pain. Today, we are going to be talking about 5 things that you can do to effectively communicate your chronic pain or chronic illness to your healthcare professional. All right. I know that if you have been in pain for any amount of time, going to the doctor is starting to become an event that creates PTSD, right? The appointments are so short. It's frustrating. You get cut off. You're having 2 different conversations. And I want to acknowledge that healthcare professionals don't want this either. It is driven mostly by insurance, and it sucks. And everybody thinks it sucks. The conversations with healthcare professionals, they think it sucks. The conversations with patients, oh, I'm going to sneeze. Pardon me. The conversations with patients, they think it sucks. So we are going to try to help our healthcare professionals out by being prepared. Okay. It's not your fault. It's not really their fault either. So let's cut them some slack, and we're just going to try to work within the system that we're in. This is specifically to US people in the US consuming US healthcare. These things can also help you if you are in other countries. But I do not know as much about your healthcare system as I do my own. So if you find these helpful and you live in a different country, fantastic. And in the comments, please feel free to comment what country you are from and tips that you would give somebody from your country in addition to these, because we should be a community that helps each other out, right? All right. So the first thing I do before I go to any doctor, especially a new doctor, is I gather my thoughts and concerns several days before the appointment. I jot down my symptoms, noting when they began and their frequency. And it's crucial to track any changes or patterns, because these are insights that can be enlightening to our medical providers. Okay. So I make a list of my symptoms, even those that seem minor, because details do count. When we are speaking to our doctors, they are looking for patterns. So even if something seems minor to me, I leave it in because it may be the thing the doctor needs, or the doctor needs to go, oh, not this, but this. Okay. Next, I reflect on the impact that these symptoms are having on my daily life. And this helps me to articulate the urgency and the severity of my situation. I prioritize my concerns, focusing on what affects me most. This preparation ensures that I cover the most important things during this very limited appointment time. The rule of thumb is 1 concern for primary care. One concern when you see your primary care, and 2 to 3 related concerns when you see a specialist. Okay. Does that suck? Yep, sure does. I didn't make the rules. I'm just helping you understand them so that you're less frustrated when you go to the doctor. It is what it is. I also keep a current list of medications with me, things that I have tried, and my responses to them. Think bullet point list, not paragraph. And I usually ask, would you like to know what I've tried and my response to it? And if they say yes, I read the bullet point list. If they say not at this point, I just keep it. Okay. I do this to be efficient, not because I think my doctor doesn't care. I've learned that that's generally not the case. It's just, there's just not enough time. So I am trying to set the stage for a productive dialogue. An example of this, in 2021, when I had COVID, 3 months later, I was having very, very rapid tachycardia, like 180, 200 beats a minute. That, while standing, that's abnormal. I was concerned, had an appointment with my primary care. There were a lot of other things going on, But this was the biggest concern that I had. And I said, hey, doc, heart rate, here's how this is happening, causing me to be very tired, like scared, worried about endocarditis, pericarditis. What do I do? Now, there were a ton of other things going on. I couldn't sleep. I couldn't regulate my body temperature. I was having hot flashes. Like, there were a whole bunch of other things. Those were not nearly as concerning to me as this heart rate thing, right? I told him how it was affecting me. It's making me very dizzy. I'm almost passing out. I can't work. I can't focus. It's happening when I'm sleeping. It's happening when I'm awake. I feel like I'm not getting enough oxygen to my brain or the rest of my body. These are the things I am concerned about medically. How do we, like, should I be worried about anything else, and how do we get this solved? And he ordered me a Holter monitor. The appointment took less than 15 minutes. I got the treatment I needed to make the next step. He got the information he needed to be able to help me in that situation. It did continue to escalate. I had to go see a cardiologist, new doctor. I don't like new doctors. I love my primary care. We have a decade-long relationship at this point. We get each other. We know each other. It's safe. New doctors, not so safe. So same thing, came in with the information. I said, the one thing that I want to know is my heart damaged, or is this autonomic nervous system electrical? Like, I don't know how to figure that out. I need you to help me figure that out. That is what I am looking for. That is what we did, which then ended up with me seeing an electrocardiologist, because there was nothing wrong with the muscle of my heart, but there was something wrong with the electrical system. None of these appointments took more than 15 minutes. We were able to get it all done in that time that they allot for you, because the reality is, in the United States, almost all doctors have 4 1:00 appointments, and 4 1:15 appointments, and 4 1:30 appointments. The reason that they do this is because there are so many no-shows that they have to keep their books full in order to keep the lights on and all the employees employed. And most of those employees are working on your insurance. If we didn't have insurance, expenses wouldn't be this high. Just saying. Anyway, so please don't be mad at your doctor. It's not their fault. It is the larger company that owns them and is forcing them, like the rest of us, to be productive. Okay. Second thing, after you have bullet pointed everything, either in your phone or on a piece of paper, or however you're going to take that into your appointment, is be open and honest about your pain and the effort that you are, like, the effort that it takes to live, the effort that you are going through to live, right? Transparency in communication is pivotal. And I never hold back on how my life is being affected by my pain at this point. I refuse to do it. I moved from giving numbers a long, long time ago to having chats. So I talk about the characteristics, the history, and I give an analogy and a timeline. Chat. I will link that in the show notes below, so that I've got a worksheet that you can fill out that you can take with you to go see your doctor. But I'm tired of playing the game, like trying to look well enough. But because you know. So I find the chat format especially helpful when talking with, like, physical therapists, occupational therapists, things like that, because it's really hard to admit when something fails, but it's critical that we find the right solution. So we're going to be open and honest about pains and treatments, and we're going to have a chat instead of, we'll give them the number because they need it for insurance, but to communicate what we need them to understand, we're going to have a chat. Characteristics, history, analogy, timeline. Third rule for healthcare professional appointments: if something isn't clear, ask for clarification. Questions are tools for digging deeper. They help me understand the why and the what behind all the medical jargon. Asking questions empowers me to participate in my healthcare journey. Okay? Stop worrying about what they think. Stop worrying about being a nuisance. Ask the questions. You're going to advocate for yourself. Okay? Standing up for my health is a need that I have, and I take it very, very seriously. If I sense that my concerns are being brushed aside, I respectfully insist on clarification. It's not about being confrontational. It's about ensuring that my voice is heard. And sometimes I find it necessary to repeat my most pressing issues, okay? Emphasizing how this is affecting my life. It reaffirms their importance, not just to me, but in the context of my care. Persistence is important in today's healthcare system. If a proposed solution doesn't sit well with you, doesn't match your values, doesn't match, your finances, say something. You have the right to say something. That's important to know. It is a suggestion that they are making based on schooling and guidelines and a bunch of other things. But it doesn't mean that it's the only way. Ask for alternatives. The last tip is asking for more support or a second opinion, because that is within your rights. And research has shown when patients get a second opinion, they are more likely to choose the intervention that matches their values. They are more likely to be satisfied with that choice. And last but not least, that the intervention that they do end up choosing, because they've had two opinions, tends to help more. And you feel happier about your choice. So, get the second opinion. Seek the best care possible. It's not distrusting your doctor. It's just an act of self-respect. When necessary, which is often these days, I request written information or referrals. That way I can expand my resources and understanding. And honestly, being proactive like this has opened my mind to new pathways that I hadn't considered before. I fell last fall and had shoulder pain that I was happy to push through until I was kind of wondering if something was like really wrong, because we were out past typical tissue healing times for things like that. And so I went and I saw an orthopedic doc, and he had suggested some things that I wasn't real convinced I needed. And I said, could you please just send me some of the most current research on that? And I will be through the patient portal, I'll be happy to read it and then let me get back to you. Well, stuff had progressed in the shoulder in that area since I had last dug around. I'm glad I asked. I got the injection. It was a cortisone injection, which I am typically against. But for whatever reason, the solution that he was using and the research that he sent me, and I double checked because I'm able to read the research papers. I understand not everybody can, but that is certainly within my bag of tricks. And in any case, I got the injection, and within a few days, all of the pain went away and I had full mobility, and it's been fine ever since. So the injection may not be the right thing for you, but asking for the information is what enabled me to make the decision to go ahead and do the injection. So ask for what you need so that you can make the best decision for you. Navigating the American healthcare system is painful at best these days. And it's far, far, far more painful if you're female and in chronic pain that's invisible. And I understand that. These are the things that I use to not lose my ever-loving mind and not completely distrust the healthcare system. And I hope that these 5 things help you too. I will see you next week.